Good morning. It's my privilege to introduce our two guests to talk about sleep today. Chantale Pamplin and Rav Johal of Mainland Sleep Diagnostics. They have agreed to talk to me on the many different topics relating to getting a good night's sleep. Chantale, can you tell us about yourself and your interest in sleep?
Sure. Hi. So I'm Chantale Pamplin. I'm a respiratory therapist by training, and most recently have become a psychotherapist. I really believe that sleep is foundational to everything to do with our health. And I've become interested in sleep over the years, both in sleep diagnostics and then through psychotherapy and helping people get a better night's sleep.
Can I switch over to you, Rav? Can you tell us a bit about your background and why you were pleased to help us when I first contacted you?
Yeah. So my name is Rav Johal. I'm a respiratory therapist as well. I worked with Chantale at Richmond Hospital kind of in the late 90s. But I started working in the sleep lab at Richmond Hospital in 95 and then did some training in the States to become a polysomnographer. Those are technicians or therapists, you can call them, that monitor your sleep at night in labs, your brain waves, your breathing, your muscle movement. So I was able to see lots of different types of sleep disorders and a wide range of people that were coming in. And I'd follow up with them after they were treated, and there was a big difference in the quality of life, not just in their health, but how they felt as well. So I kind of really was intrigued by sleep and wanted to be a big part of it. So really my whole life, my working life has been dedicated to sleep. And I think we've been a big part of the positive changes that have occurred in the industry. So when you had called me, Pat, I said, this is something that, we're really passionate about and I've dedicated our life to it. So however we can help a patient out there with any type of advice, we'd love to do that.
Why do we sleep? And what happens when we do?
So Pat, sleep is, we can go without eating for weeks, but really we can't even go without sleep for a few nights. Sleep medicine has evolved over the last 30 years as polysomnography, they call it, has come into kind of the forefront of how to measure sleep. Polysomnography essentially is an overnight sleep study that measures brain waves, gives us an idea of what stage of sleep that we're in. It measures eye movements, which allow us to find out if we're in that rapid eye movement sleep, REM they call it, where our memory gets imprinted. It's a very relaxing sleep. Allows us to determine muscle activity. Some people have restless legs. Checks our heart physiology. Our blood pressure should drop at night. So different things happen cardiovascularly when we're sleeping at night, and then our breathing as well. That's what we look at when we're doing these overnight sleep studies. So sleep is important because it boosts your immune system. It relaxes your heart, drops your blood pressure, and allows your memory to start to record everything that you're thinking about the day prior or your studies. So it allows us to do a lot of things that are important for daily function.
So what we know is sleep is very complicated. We don't actually have a fully approved theory of why we sleep. So there's several theories. So one theory is inactivity theory, where through evolution, through an evolutionary perspective, people assume that animals who are inactive at night were less likely to be targeted as prey. So that's one theory. Then there's the energy conservation theory, where it reduces your energy demand during part of the day and night, and allows your body to sort of restore its energy and maintain its metabolism. The other one is a restoration theory, where our bodies are assumed to repair and replete cellular components at nighttime. And this is actually one of the most popular theories now. And this is backed by many findings showing that our immune system is very functional at nighttime. Many of our hormones are secreted at nighttime while we're sleeping. And the last one is brain plasticity theory. And sleep is necessary for neural reorganization and growth. And Rav alluded to this, that our memories are processed at night. So people who have poor sleep or lack of sleep generally tend to recall more negative memories because memories haven't been processed appropriately. It's quite interesting. Studies show that people who do not sleep well tend to have more of a negative affect and even mood disorders.
How much sleep do we need? And does our sleep change as we get older?
Okay. Yeah, so I mean, sleep is how much sleep we need depends on our age as well. So as you can see in newborns, they sleep anywhere from 12 to 18 hours. And they're a lot of the time they're actually in REM sleep. So majority of the night, they're in that rapid eye movement sleep. And as we age, the amount of sleep that we get decreases, and 7 to 9 hours when you're an adult. And that some of the teens will sleep still, 8.5 to 9.5 hours or more, because sometimes their circadian rhythm is off. They're up late at night watching TV, which affects the amount of melatonin that's being released, and which we can talk about later. But essentially, as we approach over adult age, we should really be getting 8 hours sleep. And our sleep cycling from awake to kind of this different stages, which we'll talk about. A full sleep cycle lasts about 90 minutes. And that's important to have one full cycle, which is awake. Then there's stage 1, stage 2. Stage 1 is a lighter sleep. Stage 2 is the sleep that we're in a lot. Stage 3 is very slow wave sleep, where electrical activity of the brain, if we were to measure it, looks like waves. It's very, very slow. It's a really good sleep, very protective in nature. And then we go to REM sleep, which is that memory sleep, or that very deep sleep that we get, where your body's paralyzed, but our brain is quite active. And that one full cycle takes 90 minutes. And we should have 5 of those cycles, which will equate to about 8 hours. Now, as we approach middle age, the amount of sleep that we get by default will start to decrease. And every 10 years from middle age, moving forward, let's say from 40 years old, every 10 years, we'll have 27 minutes of less sleep just by default, without, that's just how our bodies process the amount of sleep that we should be getting. So as we age, the amount of sleep decreases. The time in bed actually for elderly increases, total sleep time and total sleep efficiency decreases. It should take us about 10 minutes to get to sleep. Once we're asleep, we first go into stage 1. And the reason we know that we're in this sleep is because of the monitors we put on our brain that measure electrical activity and our eye movement. So the eye movements become very slow and rolling. Our electrical activity brain goes from, like, if we looked at it on a graph, it looked like a sawtooth pattern, but it starts to slow down a little bit. So there's different things that happen that we know that we're in stage 1. And that's a transition from awake to stage 2. Sometimes people think that they're still awake in stage 1, but they're sleeping. And that only lasts minutes. And then once we're in stage 2, this is where our body temperature will start to drop, our heart rate and breathing become regular. This is where our processing and storing basic memories occurs. This is the stage of sleep that we should be in about 50% of the night. And as the night progresses, we get more and more of this stage of sleep. And this sleep is really important. They call this slow wave delta or stage 3 sleep. Now, they've done research studies in seniors, elders, and as they, usually as we start to approach our senior years, we have less of this sleep. But this sleep is very protective in nature. And what they're not 100% sure, but they feel this type of sleep is very important to have even as we age, although we have less of it. And they're trying to learn how can we get more of this delta sleep. Patients that are living in their 70s and 80s that are healthy they're finding they still have this delta sleep. So this is a type of sleep that even myself, I'm trying to figure out how can I get more of this sleep. It's a very important sleep. This happens after stage 2. This is where the heart rate drops and your blood pressure drops. So when we're doing a 24-hour blood pressure monitoring on patients, typically their blood pressure should be dropping when they're sleeping. And that's very, very important. So again, it's a restorative sleep. Your body's is really repairing itself, boosting its immune system. It's anti-inflammatory. and just your body releases growth hormones. Yeah. And then the other sleep is REM sleep, which is a rapid eye movement sleep. This sleep is, so when we're measuring patients in a sleep lab, we're measuring their skeletal muscle tone, and of course their brain, their electrical activity of the brain. So essentially, REM sleep almost looks like stage 1 sleep, where it's very, the activity of the electrical activity of the brain is the width is quite small. So it looks like they're in stage 1. But in stage 1, our skeletal muscle tone is still quite active because we're kind of not purely asleep yet. But here, because our skeletal muscle tone, we're completely paralyzed. If we take a look at the EMG, they call it, or the electrical muscle graph, it's almost like a flat line because our body is completely paralyzed, but our brain is super active. And so this is the deepest stage of sleep. This is where dreaming occurs. The brain is being repaired, our muscles are being imprinted, our memories are being imprinted, and it's a really, really good sleep. And I talk to my kids about this all the time. And I say, as much as doesn't matter how much you study, but if you don't get your sleep, you're going to miss out on your REM sleep, which will really affect your ability to remember what you're studying. So as I was talking about earlier, we have 5 cycles of sleep. And a healthy adult will have 5 full cycles. So we need about 8 hours sleep. That's important. A lot of the times when I'm seeing patients, and we see a lot of obstructive sleep apnea patients, and even though we've treated their sleep apnea and they're still tired, but then I look into how much are they sleeping. A lot of them are getting 5.5 and 6 hours of sleep. And, so they're still tired because essentially they're sleep deprived. So our first cycle is when we go from awake to stage 1. The light sleep, stage 2, the deeper sleep, the 3, which is the delta with a very protective type of sleep. We go back to stage 2, and then we go to REM. As the night progresses, we have less of stage 1, and we start to go in more into stage 2, delta, stage 3, and then stage 2, and then back into REM. Every time when we're going into REM, we always go to stage 2 first for a few minutes. It's just the way the cycle works. And as the night progresses, we'll just get more and more REM sleep. And then the delta sleep is at the end of the night, we won't see much of it. We see a lot of it in the first third of the night.
If you are getting less REM time at night, does that affect your ability to have short-term memory recall, as opposed to those of us who are older? We can remember things that have gone on 20, 30 years ago in greater detail than we can things that happened a week or a month ago.
I haven't seen any peer review articles on that. So I would just by my own, from what we know, I would say, lack of REM sleep will affect memory, whether it's short-term or long-term, I can't say. But I think this is, when people drink alcohol, for example, like the night before a lecture, especially during, like I go to a lot of physician talks, and they talk about this quite a bit, that some of the the talks that we do the night before, if there's alcohol involved, we won't remember as much the next morning, which will affect our long-term memory as well. Okay. So so that's very, very important to know that and essentially what alcohol or some of these things do is they decrease REM sleep. So and then actually sleep deprivation also decreases REM sleep. And once we all try to get that sleep debt back, or start to sleep a bit longer, or we come off the alcohol, we get REM rebound because your body has not had REM for a while. So I think, definitely getting REM sleep is important. There definitely is a link between sleep deprivation and sleep apnea and dementia. So that there's a link there.
Chantale, how can someone get diagnosed if they think they have a sleep issue?
Sure, thanks, Pat. So there's a couple of mechanisms to get diagnosed with a sleep disorder. So all physicians and nurse practitioners can refer patients for sleep diagnostics. And right now there's 2 major types of sleep diagnostics in the province of BC. They're both through referral forms that are put out through the Ministry of Health. One is home sleep apnea testing, which is what we do at Mainland Sleep clinics. And then the other one is polysomnography, which Rav has discussed for complicated sleep apnea and other sleep disorders. So sleep medicine in the province of BC and in Canada in general is performed by a sleep physician who is trained specifically in sleep medicine and a respirologist who has similar training. They're certified by the College of Physicians and Surgeons of BC to diagnose and guide treatment for sleep disorders. And there's two provincial forms that physicians are currently using to refer patients for these two diagnostic tests. So I put a link there to the referral forms that are on our website, but they're the same referral form that are used in the province everywhere. So if a patient or an individual has a thought that they might have a sleep disorder, definitely have them connect in. You can connect in with your physician and talk to them about getting a diagnosis. Some minor sleep disorders can be diagnosed generally just by your physician without going through detailed testing. But for something more complex, this home sleep apnea testing, which we do, and the polysomnography are critically important to a proper diagnosis.
There's over 80 actual sleep disorders, and but there are some very common ones that we see regularly, which would be like circadian rhythm disorders, would be like night shift workers, or just having your jet lag, staying up late and then waking up late, that type of thing. Then there's different types of, so some of the sleep disorders that I used to see in the sleep lab when I was working there were confused. So I'll go through a few different ones. One of them was a confusional arousal, which we would get some, actually, interestingly enough, quite a number of patients referred for this. And it simply occurs when the individual is in bed. Sometimes they start up with just sitting up in bed and looking about in a confused manner, slow speech, kind of confused thinking, blunt responses to questions. And sometimes this happens from a recovery from sleep deprivation. It can happen with substance abuse, kind of forcing somebody from waking up, and you can see it in sleep apnea as well. The confusional arousals occur at the same rate between men and women. Rates are high among children and adults under the age of 35. And 3 to 4% of adults have confusional arousals, which is a lot. That's actually a lot of patients that have that. So essentially, we would be able to diagnose them in a lab. The other thing we see a lot is sleepwalking, and we probably know somebody that does this or has done it. And so it starts with a confusional arousal, with a patient would just sit up in bed. It's typically very highly inappropriate. Can be they can be agitative and resistive. They get out of the bed, they walk around. Some people can even leave the house, drive a car. It can be simple or non-goal directed, or it can be very complex. Could be due to thyroid issues, migraines, head injury, stroke, physical or emotional stress. We can see that type of thing. And some of the other ones would be REM behavior disorder. And so this is quite common as well. This is it's an abnormal behavior. It happens during REM sleep. It can cause injury and it can cause sleep deprivation. Sleep-related injury is very common with REM sleep behavior disorders. It usually occurs with kind of an action-filled, violent dream in which the individual is being confronted, attacked, chased by people or animals. Typically, the end of an episode, the individual awakes quickly, becomes rapidly alert, and reports a dream with a coherent story. So they're kind of, what they're doing in bed is they're kind of now recalling that dream. It can be causes or a defect in the brain mechanism of sleep, a lack of the protective lock of the partial paralysis that keeps one inactive during REM sleep. So REM sleep behavior disorder, as I was mentioning earlier, REM sleep is active brain, but completely paralyzed body. So they shouldn't be moving about in REM sleep because they're completely paralyzed. So we would see this happening in a lab where we can see that they're in REM sleep by the brain waves, but they're moving about. People with REM sleep behavior disorder can move and act out what's happening in their dreams. Happens in older individuals, can be associated with kind of neurological disorders like Parkinson's and Alzheimer's. Sleep paralysis is another one. It's just an unable to perform any voluntary movements at sleep onset or waking from sleep. So now you're awake from sleep, but you just cannot move. Respiration it's usually unaffected, and they remember everything, and it just lasts for seconds to minutes. And typically sleep deprivation, lack of sleep, stress, mental health issues, fluctuating sleep schedules like shift workers, stimulant medications can do it, alcohol and substance abuse.
So insomnia is an incredibly common sleep disorder, and it has really detrimental daytime sleep consequences. Insomnia can be difficulty falling asleep, staying asleep, and frequent nighttime, early morning awakenings. And it can be acute, so short-lived, or really long-term and chronic. The causes are, so people as they age tend to have more insomnia, neurological conditions such as Alzheimer's, Parkinson's, or people with stroke, heart disease, and lots of stress can suffer from insomnia, as well as stimulating medications and substances such as alcohol use. So alcohol can make you feel really sleepy and put you to sleep, but it's actually a stimulant as it starts to wear off. So pain, issues with having to go to the bathroom a lot at night. And the most significant ones are actually lifestyle factors. So behavior factors are the single biggest component of treating insomnia. And it's the one thing that people are less likely to change. So people become ingrained in their habits, and they like doing what they like doing. And then they suffer the consequences with insomnia. So there are changes in lifestyle factors, and medication reviews are the two biggest components of treating insomnia. So many common medications, or people that take a whole bunch of medications called polypharmacy, can suffer from insomnia, such as blood pressure medications like beta blockers, ACE inhibitors, calcium channel blocker drugs are actually acting as a stimulant. And they decreasing your blood pressure, but they stimulate your brain, and they can cause you to be awake at night. So the treatment is really a medical review with your physician to make sure you understand what medications you're on and the side effects. Mm-hmm. And then changes in lifestyle factors are the biggest component. One of the things that I do in my psychotherapy practice is cognitive behavioral therapy for insomnia, CBTI. And it's really around framing the connection between the way we think about sleep and the way we behave. And a lot of our thoughts and lifestyle behaviors are very deeply embedded in us. We don't even know why we want to do the things we do. And CBTI really focuses on changing those behaviors and helping people have different thoughts around healthy sleep habits. So here again is a slide just showing some of the treatment. So the biggest component of treating insomnia is actually changes in lifestyle factors. One other sleep disorder that we'd like to discuss, and this is what we diagnose and treat in our business, is obstructive sleep apnea. So I've got three pictures here. One is the normal airway during sleep, where the tongue and the soft palate and uvula are all open and have some good tone, and air is getting through really nicely. Snoring is when there's a partial obstruction, which creates a sound when you breathe out and in. And obstructive sleep apnea is when there's a complete obstruction. So all of the soft tissues and the musculature fall back in the throat, and they create an obstruction. So there's no air movement at all. And what happens during each obstructive episode is that our oxygen level drops in our body, our heart rate increases, our blood pressure increases, and then our brain partially wakes up. So we may move out of a deeper state of sleep into a less deep state. So now you're getting sleep deprivation, and you're also having a lot of stress on your cardiovascular system. So people who have obstructive sleep apnea might have the following symptoms. So snoring, choking or gasping, a headache in the morning, waking up with a racing heart or sweating, frequent waking. So because the blood pressure goes up, you can wake up a lot and have to go to the bathroom more often because you've got more blood flow going through your kidneys. People will grind their teeth, wake up with a dry mouth, And then the next day they'll have, they haven't had this restful restorative sleep. So now they're having a hard time concentrating. They have memory loss and mood change. So people with obstructive sleep apnea are highly prone to depression. Members can look at this other slide here when they get it. So this just goes over a whole bunch of the other body changes during sleep apnea. And this is the test that we do. So we do the home sleep apnea testing, which we talked about previously in the how do people get diagnosed. So you can see here, this is the monitor that we give out to patients, and they wear it through the night. And there's nasal prongs to measure airflow through the nose. There's an effort belt and a pulse oximeter to measure your oxygen level during the nighttime.
If you sleep on your back versus your side or your front, does it make any difference?
I'm actually going to ask Rav to answer that question.
It can, Pat. Usually sleep apnea is definitely worse. We'll find it to be more significant on the back. A few reasons. Number one would be that the jaw would collapse and the tongue is attached to the jaw. So, there's more chance of the base of the tongue collapsing the throat. The other thing would be that sometimes it's not just an obstruction when you're sleeping on your back. So we also see these things called hypopnea. So when we're measuring how many times an hour someone stops breathing, we look at apnea, which is a Greek word for complete stoppage of breathing, like no breath. Hypopnea is shallow breath, and index is per hour. So it's a combination of no breathing and shallow breathing, and how many times an hour do they do it. So a patient does that. So typically on the back, we'd see more apneas because of throat collapsing, and then we see more hypopneas because the stomach it pushes up on the diaphragm because it sits down towards the spine, pushes up on the diaphragm, which can impede the lungs from having a deep breath. So definitely sleeping on the back would make those things more pronounced. So sleeping on the side is definitely a good idea. But it also depends on how significant the apnea is. Sometimes even sleeping on the side won't bring the apnea and hypopnea index down to an acceptable level.
What does poor sleep bring to the health of a patient?
Mm-hmm. Thanks, Pat. It's a great question. And as I answer the question, I really want people to understand that these are really well documented and well studied outcomes. And sleep deprivation or poor sleep is extremely detrimental on our health. So poor concentration and memory, people can have mood disorders, so anxiety and depression, or poor stress tolerance. So really, I don't know if you've ever had a really bad night's sleep and the next day you're really irritable and a bit cranky. So we can have poor motor reflexes. So this actually is related to sleep deprivation is really related to car accidents. So the studies have found that people that have car accidents are often dealing with lack of sleep. Reduced sex drive, weight gain. So when we don't sleep well, we actually have increases in hormones in our body that allow us to crave more sweet things, more carbohydrates. So people generally will eat more and have higher weight gain. Aging of the skin. So as Rav mentioned when talking about the different stages of sleep, some of the stages actually are related to release of anti-inflammatory hormones and chemicals in the body, immune function, and this can actually age the skin if we're not getting good sleep and don't have these substances being released into our bloodstream. There's even issues with gene expression. So people that have poor sleep have an increased risk of diabetes, stroke, high blood pressure, heart disease, and dementia and Alzheimer's. And these are well documented. And people don't generally put this together with the fact that they sleep poorly. We're always, when I do work with people on lifestyle changes around their sleep, people really want to look to almost anything else other than changing their lifestyle habits related to sleep. So they still want to stay up late and play video games or watch TV, really bright TV, or drink excessively, or engage in activities that are really not great for sleep habits. But these are really well documented issues, and your sleep impacts all of these risk factors. and then we look way downstream impacts. If you're having a mood disorder related to sleep or you're irritable, this actually strains your relationships. So, there's a lot of downstream impacts. Sleep is incredibly, incredibly important for overall health. So being physically active is very, very important for our body. And it actually makes it easier to sleep at night, but you don't want to exercise right before going to bed. Because when you're exercising, you are releasing chemicals and hormones in the body, and your blood pressure is increased and your heart rate is increased, and the body takes time to actually come down from that. So I would say, not exercising within a couple of hours of going to bed is really important. And overall sleep hygiene, as you can see here. So, and these are things that people find really hard to change, but they really do help. So set a sleep schedule, have a fixed wake up time, prioritize sleep. So making sleep a priority is actually a decision that you can make. And when you prioritize sleep, you're generally more capable of making those lifestyle adjustments. So don't overdo it with naps. So people that nap excessively in the afternoon can have less REM sleep at nighttime. Keeping your routine consistent and budgeting 30 minutes for winding down. And those 30 minutes really involve reducing your lighting. So lighting is a big component of sleep. So getting enough daylight exposure, or dimming your lights and then dimming your lights close to bedtime. So our body's circadian rhythm and melatonin production is actually all related to light. So through evolution, we would get a lot of light time during the daytime. And then as soon as the nighttime came, people would go to sleep. So build in a 30 to 60 minute pre-bed buffer time that's device free, or wear there's special glasses that you can get with lenses that block out specific light wavelengths. Black, one thing I do, people think I'm crazy because I do this, but I actually have little pieces of black tape over anything that has an LED light in my bedroom. So just that black hockey tape, little piece over an LED light, that can actually make a huge difference in terms of your brain achieving a really great deep sleep. And blackout curtains. And so those are, setting a schedule and great lighting. So really responding to light, having good light during the daytime and then complete darkness at night. Relaxation. So as part of prioritizing sleep, doing a relaxation activity, including meditation or breathing exercises in the bed can really help you fall asleep and really calm your mind. If you find that you're tossing and turning, get up and get out of bed and do a relaxation technique, or go sort of sit and do a very mild relaxation activity, and then go back to bed. So people that get into bed and have a hard time falling asleep tend to engage in that cyclical pattern of thoughts about sleep and that stress about not falling asleep or staying asleep, which is part of the thought process challenges that people have when it comes to sleep. That increases your stress, increases your heart rate, your blood pressure, and then you're going to have a harder time falling asleep. We've talked about reducing alcohol. So alcohol can make you very sleepy. And a lot of people use alcohol to actually fall asleep, but it wears off. And a whole bunch of chemical components in the body related to alcohol make it when it wears off, disrupts sleep later on. So I don't know if you've ever had people that have a few glasses of wine, go to sleep really quickly, and then they find they're awake halfway through the night. Again, eating dinner late, a big heavy meal. When our body is digesting, it's very active, and that can actually impede sleep. Using the bed for sleep only. So sleep or sex are the only things that should be happening in the bed. So working in bed or watching TV in bed is really not conducive to good sleep habits. And then optimizing your bedroom. So everybody has a different ideal bedroom optimization. So for me, in general, we want to lower the temperature because our body temperature drops during sleep, and we want to match that. So lowering the temperature in the bedroom, reducing noise. So a white noise machine is a really great idea. I actually take mine with me wherever I travel, using essential oils, such as lavender, which can also promote sort of healthy sleep. And I think the big thing here is There's lots of great tips and ideas. You can find lots of great ideas online, but sleep is very personal. So create the ideal sleeping environment that suits your needs. So some people are, temperature sensitive, or they have specific mattresses or pillows that they find are comfortable. If you prioritize sleep, you'll prioritize these things that are actually important for your own personal style of sleeping.
If we prioritize our sleep, and we want to make sure that our bodies are ready for sleep, what about supplements that can be used to assist us to get to sleep and stay asleep?
Yeah. So I will preface this that all discussion on supplements should be collaborative with your doctor or your nurse practitioner. So people that have complex medical conditions or take medications really want to make sure that there's not an interaction. So always talking with your physician about supplements that you're taking is incredibly important. And supplements will only work for sleep also if you make the other lifestyle factor changes. So they're complementary. So, and I've done extensive research into supplementation. And again, talking with your doctor would probably know most of these supplements. So the first one is magnesium. So the standard North American diet is actually lacking in magnesium. It's a critical mineral for optimal nervous system function. So I don't know if people that take a magnesium supplement actually will feel kind of a warming sensation in their body a couple minutes after taking it. And clinical trials show that magnesium helps people fall asleep more quickly and stay asleep longer. And there's several great magnesium supplements you can take either in a pill or a drink format. And if you feel that warming sensation after you take it, it generally means that you're deficient in magnesium. Melatonin. So melatonin is a hormone that we secrete at night to signal that it's time to start preparing for sleep. And melatonin, as I mentioned before, is completely dependent on our stress levels, our access to daylight, and then darkening at nighttime. Stress, excessive light in the evening, and caffeine can all inhibit its production and make it hard to wind down. There are a variety of melatonin supplements. I'm sure everybody has seen melatonin somewhere, and they're generally between 1 and 10 milligrams. And it can support your natural circadian rhythm. I much prefer to actually reduce the stress and the nighttime light. It's actually more beneficial, but if you need to supplement on days when you're, you know that you're going to have a hard time winding down and you've had a lot of light exposure in the evening, this can be really helpful. I would start with a really low dose and then move up as you're needed. I put little hearts beside GABA and L-theanine. These are my two favorite sleep supplements. So GABA is actually a naturally occurring transmitter that we have in our own bodies, and stress and light can also reduce the amount of GABA in our bodies. It has an extremely strong calming quality, can also cause a brief warming sensation after you take it, and then it sort of lasts for 1 or 2 minutes. You can take GABA without any side effects before bed, or if you wake up at night and can't fall back asleep. So if you wake up, you're having insomnia and you're up between 2 and 4, if you take GABA, it can help you with that calming sensation. Doses are anywhere between 10 milligrams up to 500 milligrams. And again, I would talk to a physician about that supplement. And the other one is L-theanine, which is an amino acid found in green tea. So it blocks receptors in the brain that initiate a stress response, and it's been shown to help promote sleep. So doses are between 200 and 500 milligrams. And the last one is botanical extracts. I know, Pat, you mentioned some people had questions about things like valerian, lemon balm and hops, passion flower. So a lot of these extracts can be purchased as a tincture in the natural food stores. They all have calming properties. I'm not an expert in dosing, but definitely I know when I've walked into a health food store and talked to somebody about these, people generally seem to be quite experienced in providing, consumers with dosing. But I would really strongly suggest talking to your physician about botanical extracts before taking them if you're taking medications. Yeah, so those are the ones that are considered the most popular and well studied. But again, just those precautions, if you're somebody who's taking medications, to make sure you check those out with your doctor.
Sure. Yeah, I think that's probably the biggest key is if you're having problems getting to or staying asleep, consulting with your own physician to start with, and then ultimately work it through with your personal physician. And if there's a recommendation that they go to specialists such as yourselves, that's what you need to do. Don't try a lot of things on your own that don't have a lot of relevancy. Mm-hmm. And I certainly am most appreciative of the effort that you have gone to, you and Rav. Thank you ever so much.